again, everyone. This is Dr. Alan McCord, continuing our series called Ask Dr. McCord. In this episode, what we want to talk about is dizziness. A lot of people can experience dizziness throughout their life for a varying number of reasons, but one of the things that can actually happen is the actual balancing mechanism, what's called the vestibular mechanism in the body, which keeps your body balanced to gravity when you're upright, walking, or sitting, is controlled by three different anatomical structures in the body. First of all, your eyes, which keep your head at horizon. And then there's a vestibular mechanism actually in the inner ear called the semicanal rings. And they are three rings that are in three different dimensions, and they have fluid in them, and on the inside lining of these tubes there are little hair-like things called villi, and when you move or tilt your head or your body shifts, what happens is the fluid in those tubes actually moves around. The villi float with the fluid shift, and it gives your body an idea of how your head is moving in relationship to space. The other real critical part of this is the proprioceptive feedback that are in the joints of your neck. So what happens is people can have different instances where they're bending down looking underneath a dock or in an accident or a fall, jamming their spine in the neck, and it can cause an imbalance in that communication system, causing people to be dizzy. And so we here at Kent East Chiropractic are trained to be able to evaluate that for a patient, and we've helped a lot of people that have experienced dizziness as a result, that unrelented from other things that they've tried. So if you're having some dizziness, it might be well worth your time to come in and get checked here at Kent East Chiropractic. Once again, we want to challenge you to subscribe to our YouTube channel here, and thanks again for joining us on Ask Dr. McCord.